Ladies and gentlemen, colleagues and friends, it is a great privilege to be able to speak to you today, even if I do so virtually. In this presentation, I plan to talk about some of the global, regional and local perspectives of the issues facing children and young people today. In doing so, I will allude to some of the opportunities that children's nurses, either individually or collectively, can take to tackle and influence services and outcomes for children, young people and their families. For the purposes of this presentation, local relates to the UK, regional to Europe, even though we've exited as such politically, and global to international perspectives. Children epitomise the future and underpin a country's potential economic growth. Young children are, however, extremely vulnerable to malnutrition and infectious disease. Ensuring their health, growth and development ought to therefore be a prime consideration of all societies. Nearly 10 million children under 5 die every year, more than 1,000 every hour, many of which could have been effectively prevented or treated. Most could survive threats and thrive with access to simple, affordable interventions. Europe, for example, includes countries with the lowest infant and child mortality rates in the world. It also includes countries where children are 25 times more likely to die before the age of 5. Every year, too many children in the region die before the age of 5, 52% of them in the first month of life. Mortality varies not only between but within countries. Even high-income countries have child poverty as a risk factor, for poor health and inequality is growing. I am sure you can think of areas of the UK and even within your local area where there are marked differences, with the current economic crisis exacerbating further. Across the world, children still die due to preventable causes such as pneumonia and diarrhea, and there are warning signs of the return of diseases previously under control, such as diphtheria and tuberculosis. The true measure of a nation's standing is therefore how well it values children and how they ensure their health, development and safety within communities and societies as a whole. Most children in the World Health Organization European region have a happy, healthy childhood and adolescence, where they grow and develop into prosperous adults. In this period of the life course, identity is formulated, experimentations are made, and independence is developed. However, inequality between and within all European member states, lack of access to quality services, maltreatment and unhealthy lifestyles are negatively affecting health among the most vulnerable groups in society, children and adolescents. Investing in health and social care and education in early childhood and working with families who require support to improve their parenting skills has proven to be the most effective way to improve development and reduce inequality. Evidence shows that high-quality early years investments and services can compensate for the effects of social disadvantage on early child development and promotes the full developmental potential of all children. Such efforts must be continued throughout childhood and adolescence. While there is variation within and between countries and societies in respect of the degree that children and young people face, the underpinning reality is that many face abuse, violence, and exploitation. There were nearly 153 million orphaned children across the world in 2021. 87.6 million of whom lived in Asia. There are currently 168 million child labourers, accounting for almost 11% of children. In the world's poorest countries, around 1 in 4 children are engaged in child labour. It is estimated that 263 million children and young people are not in school. Children are 4 times more likely to be trafficked for labour rather than sex. Children account for 27% of all the human trafficking victims worldwide, and 2 out of every 3 child victims are girls. Children who are trafficked for labour purposes might be removed from their families and forced to perform domestic household services, or work in factories or agriculture. Though millions of children are trafficked, there is a much larger number of children involved in child labour that is not considered trafficking. Around half of child labourers participate in what is known as hazardous work, work that endangers the child's physical, emotional or social well-being. The UN Convention on the Rights of the Child, ratified by most member countries apart from the USA, and are embedded in national and regional policy, sets out principles across 54 articles. Articles 43 to 54 are about how adults and governments must work together to make sure all children can enjoy all their rights. The Convention applies to every child without discrimination, whatever their ethnicity, gender, religion, language, abilities, or any other status, whatever they think or say, whatever their family background. There are also optional protocols and agreements covering the involvement of children in armed conflict, which requires governments to increase the minimum age that children can join armed forces from 15 years, and to ensure that under 18s do not take a direct part in armed conflict. Another optional protocol relates to the sale of children, child prostitution, and child pornography, which provides detailed requirements for governments to end the sexual exploitation and abuse of children, as well as protection from being sold for non-sexual purposes such as forced labour, illegal adoption, and organ donation. A further optional protocol concerns communications, allowing children to submit a complaint to the United Nations when their rights have been violated and their own country's legal system were not able to offer a solution. Every child has therefore the right to survival, protection and education. Access to education including understanding their rights, as per the UN Convention on the Rights of the Child, is critical to ensuring children and young people are valued within societies across the world. In many countries where there is conflict, children at a very young age are, however, recruited to fight and to be engaged in conflicts as soldiers, their childhood being lost forever. Although it is impossible to accurately calculate the number of children involved in armed forces, it is clear that there are many tens of thousands of child soldiers. Between 2005 and 2020, for example, more than 93,000 children were verified as recruited and used by parties in conflict, although the actual number of cases is believed to be much higher. Child soldiers exist in all regions of the world and almost inevitably where there is armed conflict. Wars have always victimized children, but modern wars are exploiting, maiming, and killing children more callously than ever. Up to 2 million children have been killed in war in the last 10 years. 4 million have been permanently disabled. 1 million children have been orphaned. 12 million children have been displaced. 500,000 children died following sanctions in Iraq, for example, and an unknown number as yet due to the conflict in the Ukraine and Sudan. Children caught in the midst of critical stages of personal development are affected by war more profoundly than adults. Children and young people are often displaced, lose parents and other adults as a result of conflict, with many ending up as refugees. In 2018, 1 billion people had moved or were on the move, either as a result of internally displaced persons, international migrants, or refugees, including many children as a result of conflict, violence, or inequity and lack of opportunities. In 2019, nearly 80 million people were displaced, with a third of these becoming refugees, children forming over 50% of all refugees. Life isn't easy for young refugees. After long and harrowing journeys, they arrive to endless questions from immigration. Tired and traumatized, they're grilled on how old they are and where they've come from. Without knowing the language and how things work, young refugees have to fight hard for basics like food, safety, and housing. Arriving alone in a new country is scary. People will take advantage of children on their own. Without a trusted adult to look out for them, child refugees may be manipulated into forced labour, criminal groups, or sexual exploitation. Children in refugee camps and living in poverty in poorer communities are at increased risk of injuries, with 1.3 billion people across the world living on less than $1 a day. They are more likely to live in hazardous conditions, lack access to clean water and sanitation, or access to healthcare services and adequate food and nutrition. Residing in homes with open fires, unprotected windows, unsafe roofs and stairs, or near dense, fast-moving traffic, and often lack spaces and facilities for safe play. There are an estimated 4 million children living in poverty in the UK. That's 30% of all children. Projections indicate that this number may rise to as much as 5 million by the end of the decade, yet national targets to reduce child poverty have been abolished. The underpinning inequitable distribution of wealth between and within countries exacerbating child poverty across the world. Much of the morbidity and mortality among children and young people is preventable. Low-cost measures that have been shown to work, whether they target road traffic accidents or poverty, could prevent 2/3 of deaths. Children are particularly vulnerable to environmental pollution, and poor environments aggravate socio-economic disparities in cities. Children and adolescents need clean air, safe housing, nutritious food, clean water, and a healthy way of life. They need friendly services that they can reach and that can reach them. The UN Convention on the Rights of the Child highlights a child's right to feel safe and to be looked after properly and to have a say in what happens to them. UNICEF has set out fundamental principles for realising children's rights to a safe, clean, healthy and sustainable environment, and for putting the best interests of children at the forefront. It provides essential policy guidance for governments, civil society, businesses, the media and children to implement these principles. Children are particularly vulnerable to adverse health effects from indoor and outdoor air pollution, which causes an estimated 7 million deaths per year. Air pollution is associated with poor childhood respiratory health. It impairs the lungs and the brain and increases the risk of cardiovascular disease, obesity, type 2 diabetes, and metabolic syndrome across the child's lifespan. Climate-related health risks are compounded amongst the 40% of the world's children who live in informal settlements, where substandard housing, overcrowding, hazardous locations, unhealthy living conditions, poverty, and poor access to basic services can harm their health and well-being. The climate crisis is therefore a child's rights crisis. For far too long, children's rights have been ignored in climate and environmental policies. Almost every child on Earth is exposed to at least one form of climate and environmental hazard, shock or stress, affecting their ability to realise the rights guaranteed to them. Children's lives today and future existence are undoubtedly at risk from rising sea levels, extreme weather events, water and food insecurity, heat stress, emerging infectious diseases, and large-scale population migration. The climate crisis, pollution, and biodiversity loss are threats that will transform childhood and jeopardise a sustainable future for children and future generations globally. If we look at older children, there are more deaths related to injury than to communicable diseases. All children have the right to a safe environment and protection from injury. So what role could and should children's nurses, individually or collectively, play locally or regionally in relation to this agenda? Over 800,000 children die every year from accidents. 2,300 children a day. More than 1,000 of these children could be saved if proven injury prevention measures were applied. Road traffic, crashes, drowning, burns, falls and poisoning are the leading causes of child death from injuries. In the UK, over 50% of drownings occur in June and July each year. What measures would you ensure were put in place to reduce the number of children and young people that drown each year? Seatbelts and child restraints, helmets, pedestrian lanes, use of daytime running lights for vehicles, speed limits, laws against drinking alcohol and driving, and graduated driver licensing, which limits driving privileges for new drivers, are among the most successful interventions to prevent and reduce road traffic injuries. In many Asian countries, drowning is the leading cause of death from injury. Successful interventions to prevent drowning include the use of life jackets, fencing around swimming pools, covering water hazards, and prompt first aid in an emergency. So what role could children's nurses play in promoting such preventative measures locally or regionally? Every day, a significant number of children die from burns, poisoning and falls. Burns from flames and hot liquids can result in long-lasting disabilities. Preventative measures include smoke alarms, child-resistant lighters, hot water temperature regulators, and access to dedicated paediatric burn centres where trained staff and equipment are available can reduce the consequences of injuries. Severe falls can be avoided by fitted window guards, specially designed children's products, playground equipment that meet safety standards. Again, what role might children's nurses have in promoting such safety measures? 25% of all adults report that they have experienced abuse as a child. A child who is abused is more likely to abuse others as an adult, so that violence is passed down from one generation to the next. With the consequences of child maltreatment, including impaired lifelong physical and mental health, the social and occupational outcomes of which can ultimately slow a country's economic and social development. Preventing child maltreatment before it starts is, however, possible, requiring a multi-sectoral response with effective prevention programs supporting parents by teaching positive parenting skills. Children's nurses have a key role in safeguarding and protecting children and young people, listening to their voices, recognising the signs of abuse, and reporting concerns as per local policies and procedures. Uncertainty over the future is a major concern for many young people. The pandemic has highlighted and accentuated social inequalities. People are expressing deep financial concerns as we head further into a recession. In particular, children and adolescents of all ages and in all countries are therefore seriously suffering from the consequences of the pandemic. COVID-19 related measures had a profound effect on their health and well-being, and for some, the impact will be lifelong. For example, COVID-19 created the largest disruption of education systems in history, affecting nearly 1.6 billion students in more than 190 countries. In addition, according to the World Health Organization Pulse Survey on continuity of essential health services during the COVID-19 pandemic, which was published in August 2020, 90% of countries reported disruptions to essential health services since the COVID pandemic started. The most frequently disrupted areas reported included services essential for children, such as routine immunization, including 70% of outreach services and 61% of facility-based services. While pre-pandemic global poverty rates had been cut by more than half since 2000, the COVID pandemic could increase global poverty by as much as 500 million people, or 8% of the total human population. The most important indirect effects are related to school closures, which have disrupted the provision of educational services, and increased emotional distress and mental health problems amongst children and young people. When unable to attend school and in social isolation, children are more prone to maltreatment and sexual violence, adolescent pregnancy, and child marriage. The harmful effects of the pandemic have therefore not been distributed equally. Children living in vulnerable situations continue to be disproportionately affected in relation to their long-term health outcomes. Promoting children and young people's well-being is a key part of keeping them safe, helping them develop and ensuring that they have positive outcomes into adulthood. A greater number of children and young people have experienced mental health issues during the pandemic as a result of lockdowns and isolation from peers, routines, and the school environment. Currently, 1 in 5 children have a mental health disorder. 50% of mental health disorders begin before the age of 14. 13% of teenagers may experience depression before reaching adulthood. Those with severe mental health disorders die at a younger age than their peers. Europe includes countries with the highest adolescent suicide rates in the world. In England in 2021, a quarter of 11 to 16-year-olds and nearly half of 17 to 19-year-olds with a mental health disorder reported that they had self-harmed or attempted suicide at some point in their lives. Suicide may be linked to many factors, including poor mental health, self-harm, academic pressures or worries, bullying, social isolation, family environment and bereavement, relationship problems, substance misuse or neglect. Risk factors are cumulative over the life course, and adverse childhood experiences, deprivation and poor physical health also contribute to the risk. The rates of suicide and deliberate self-harm among children and young people has increased dramatically over the last 20 years. There are marked differences between countries and between the sexes, with young men being 3 times more likely to take their own life than their female peers. The importance of sleep to both physical and mental health have until recently not been fully acknowledged or understood. A recent NHS study found that a significant percentage of children and young people have experienced sleep problems. Research has found that problems with sleep are higher amongst those who have a mental health disorder. In a recent study by the Royal College of Paediatrics and Child Health in the UK, 88% of children and young people said that screen time had a negative effect on their sleep, and 35% said that screen time had a negative effect on their mood and mental health. The rise of technology has had a significant impact on the lives of young people. Technology has many positives, enabling young people to connect with family and friends. However, there are significant risks. For example, young people navigating social media might be exposed to inappropriate or upsetting content that they are unprepared to witness, as well as the risk of exposure to cyberbullying, privacy issues, and a waning awareness of reality. Cyberbullying has replaced bullying as the most common type of harassment that young people experience. Children and young people may consent to sending a nude image of themselves. They can also be forced or coerced into sharing images by their peers or adults online. If the image is shared around peer groups, it may lead to bullying and isolation. Perpetrators of abuse may circulate a nude image more widely and use this to blackmail a child and/or groom them for further sexual abuse. It's important that anyone working or volunteering with children and young people understands the dynamics of sexting. You should know what to do if you ever need to help a young person who has received or sent an explicit image, video or message, or had an image shared without their consent. During the pandemic and lockdowns, many relied heavily on social media and the internet to interact with others. Police warned that social media was going to be the key cause of a rise in knife crime and gang violence once lockdown rules were lifted. Many young people smoke, drink, take drugs, and engage in unsafe sex due to pressure from peers. For example, the rate of smoking among teenagers that have 3 or more friends who smoke is 10 times higher than whose friends did not smoke. In a sample of 5 and 6-year-olds in Brazil, India, Nigeria, and Pakistan, 68% could identify at least one cigarette brand logo. 50% could do so in Russia and 86% in China. In Scotland, 4% of 13-year-olds and 13% of 15-year-olds smoke tobacco regularly or occasionally, and prevalence increases to 19% for 16 to 24-year-olds. Although drug use trends and rates vary from year to year, recent data shows that substance abuse remains a persistent and pressing problem for many young adults. In England in 2018, 24% of pupils reported that they had ever taken drugs. The likelihood of having ever taken drugs increased with age, from 9% of 11-year-olds to 38% of 15-year-olds. 17% of pupils said that they had taken drugs in the last year, and cannabis was the drug that pupils are most likely to have taken. Around 4 in 10 young people in treatment said that they had problems with alcohol. 13% had problems with ecstasy, and 10% reported powder cocaine problems. There was a slight decrease in the number of young people seeking help for heroin. Studies indicate that 1 in 4 boys and nearly 1 in 6 girls drink alcohol once a week at the age of 15, although trends vary very much across Europe. In 2019, almost 1 million young people across England reported binge drinking on 5 or more days over the past month, and adolescents aged 12 to 13 reported drinking alcohol in the previous month. In a study of 11 to 14-year-olds from Los Angeles, African American youth were exposed to an average of 4 to 1 alcohol adverts per day. Across Europe, 25% of 15-year-olds have had sexual intercourse, but more than 30% in some countries are not using condoms or any other form of contraception, resulting in sexually transmitted diseases and unintended pregnancies. Young people under the age of 25 experience the highest STI diagnosis rates in the UK. 30% of young people who have had an STI test have tested positive. Public health measures and campaigns, such as that in England, have been implemented to address the rising rate of STIs amongst young people. Many young people report that peer pressure and social media has significantly affected how they view their bodies, with the proportion of young people with eating disorders increasing over recent years. An estimated 1.25 million people have an eating disorder in the UK. Eating disorders do not discriminate and can affect anyone, regardless of gender, ethnicity, age, or socio-economic status. Eating disorders are serious mental health problems. They can have severe psychological, physical, and social consequences. Children and young people with eating disorders often have other mental health problems, for example, anxiety or depression, which also need to be treated to get the best outcomes. Most of the world's population live in countries where overweight and obesity kills more people than underweight and malnutrition. The rapid rise in childhood obesity is one of the most serious public health challenges of the 21st century, with the number of children and adolescents affected by obesity increasing more than 10 times from 11 million in 1975 to 124 million in 2016. A considerable proportion of children in many European countries do not meet recommended levels of physical activity. 1 in 3 children aged 6 to 9 are overweight or obese, and over 60% of children who are overweight before puberty will be overweight in early adulthood. Children are frequently exposed to harmful commercial marketing, typically seeing tens of thousands of ads a year for addictive substances and unhealthy commodities, including fast food and sugar-sweetened beverages, which contribute to obesity and chronic disease. Recent studies highlight the significant impact of the consumption of high levels of ultra-processed foods, with increased risk of diabetes and heart disease in later life, but also potential issues concerning cognitive ability amongst children and young people. Evidence suggests that children in some countries see as many as 30,000 advertisements on television alone in a single year, many for harmful products. A review of 23 studies in Latin America reported that advertising exposure was associated with a preference for and purchase of unhealthy foods by families and children who are overweight and obese. In Iran, food advertising during children's programs is dominated by food items that are potentially harmful to oral health, as are almost 2/3 of food adverts during children's television in the United Kingdom. 39 million children under the age of 5 were overweight or obese in 2020. Almost half of these children lived in Asia. 1 in 3 children are overweight or obese by the time they leave primary school. This increase is leading to more cases of type 2 diabetes, asthma, and high blood pressure in children. Obesity is preventable. Children's nurses have a key role in educating children, young people, and families about healthy weight, lifestyles, and food and nutrition. The way children are raised can affect how successful they will be in later life. Over time, child rearing practices have altered. What was once a time common and acceptable is no longer the case. Child rearing in different cultures can be as varied as the countries from which they come. Some practices can appear neglectful, while others just seem unusual. Argentine parents, for example, let children stay up until all hours, and Danish parents leave their child sleeping in a stroller on the curb while they go inside to shop or eat. In the Polynesian islands, it's not uncommon for older children, think toddler and preschool age, to take care of younger ones, even those who are not their siblings. Mothers in the Netherlands, Spain, and Italy place an emphasis on self-regulation through a restful and regulated environment, attention to the baby's physical and emotional needs, emotional closeness, and protecting and educating the child. Children's nurses have a key role in changing attitudes and practices, educating and supporting parents to care for their child. During the COVID pandemic, the most frequently disrupted areas included essential services for children, such as routine immunisation, including 70% of outreach services and 61% of facility-based services. Vaccination is not uniform within and across countries. Children from middle-income countries and vulnerable population groups are more likely to miss routine vaccinations. Annually, almost 1 million children in the region do not receive all scheduled vaccinations, resulting in 90,000 cases of measles and 70,000 cases of rubella being reported in the past 3 years. The take-up of COVID-19 vaccinations amongst children and young people has also varied across countries, with many parents being confused by mixed messaging about the safety and efficacy of vaccines for children and young people. More than 1 in 10 school entry aged children in England are at risk of measles because they have not had their vaccinations. Measles is highly contagious, more than COVID, and can cause serious illness. 9 in every 10 people can catch it if they are unvaccinated and exposed. Over the last decade, measles has affected over 80,000 children and adults. Children under 5 are especially vulnerable to serious complications of measles and other vaccine-preventable diseases. In 2018, 74 children died as a result of measles. Since the start of the COVID pandemic, there has been a concerning drop in the number of children receiving these vaccines on time, such that the UK Health Security Agency was extremely concerned that measles would make a significant comeback in the unvaccinated when restrictions were lifted. As a result, there have been recent campaigns across NHS England regions to address the need for uptake of routine vaccinations, particularly MMR, as vaccination rates fail to meet the World Health Organization's 95% recommended uptake. What role do children's nurses have in educating parents about the importance of vaccinations, including public health messages, are accurate and based on sound evidence? Children's nurses have a unique perspective on the important issues affecting children, young people and their families, and have a key role in ensuring children's rights, as outlined in the UN Convention on the Rights of the Child, are embedded in practice. Working with your professional associations, you can influence health policies and service provision to ensure, for example, that there is access to support and counselling services in schools to address the rising mental health issues young people face, as well as to ensure education and safeguards are in place to protect young people from the risks posed by social media. Making young people visible is the key to change. Policies should be developed taking into account their specific needs and adopting a rights-based approach. This means involving children and adolescents in the decision-making process and giving them a voice when dealing with organisations and professional bodies that are working with and for them. The World Health Organization has also highlighted the need for different sectors to work together to improve the health and well-being of children and young people, indicating that a small increase in spending focused on child development and early years could yield a 9 times economic and social benefit. To make significant change and to address many of the issues highlighted during the presentation, there is a need to work together at local, regional and global level, as well as across sectors and professional groups. Only then will you make a real difference to the children, young people and families in your communities. What do you feel is the most pressing issue to highlight to the board in your organisation or to the health board or integrated care board in your area? It only takes 1,000 letters and signatures on a particular issue to cause a debate in Parliament. What issue might you consider to be the most pressing issue to raise at this level concerning children's nursing and children and young people? I will leave you with one of my favourite quotes. To do so, you must not only act, but also dream, not only plan, but also believe that you can make a difference for children, young people and their families. Thank you for listening. I hope that the presentation has given you some food for thought and that you might lobby and collaborate to ensure a better and brighter future for children, young people and their families at local, regional and global level. The next slide poses some questions for you to consider and discuss with attendees and colleagues. I have, however, always focused not just on discussion, but actions, and so there are some of those too for you to consider, remembering that it's not all about raising points in public. Sometimes one can achieve far more and be more effective influencing behind the scenes.